Baja, and more specifically, the city of Tijuana, offers an array of medical services at a fraction of a cost in comparison to other countries. You would pay just a fraction of the cost in comparison to the United States without sacrificing quality of service and professional care. And at the same time, you would be receiving the additional element of tender loving care, which so much characterizes the Latino culture. Tijuana's condition as a border offers a great advantage in prices and logistics for North American patients in comparison to countries overseas, where the cost of transportation and additional expenses will make a difference in your pocket. An additional advantage for Baja is that most of its population is bilingual. To give you an idea of the range of medical services available, we can mention that in accordance to the state census, there are registered 31 hospitals, 62 clinics, and 290 medical offices. However, as in the rest of the world, the medical field has performance scales that allow us to distinguish between excellence and dangerous mediocrity. The overall cost of treatment does not necessarily reflect the quality of service. Keeping that in mind, it becomes very important to have the aid and support of a certified bilingual medical doctor, someone more than a translator, someone more than a promoter, your very own guardian angel, keeping your well-being in mind and assuring you a safe and successful treatment. I am Dr. Maria Batiz, a general practitioner, graduate of Universidad Autónoma de Baja California with 20 years of professional experience. My private practice in Rosarito has focused primarily in retired U.S. citizens, whether living or visiting Baja. I'm proud and honored to have the trust of over 800 satisfied patients from different parts of the United States. After listening to my patients' testimonials about the rising cost of healthcare in the United States and the long waiting periods for Canadian patients to get much needed medical treatments, I became aware and convinced that my knowledge and expertise in the medical field could help to provide an option. I strongly believe good healthcare is a necessity. Everybody should be entitled to quality care, but this should not be a luxury. For example, when was the last time your doctor provided you with a direct telephone number to call in case you had any questions? Or the last time you had an emergency, were you able to get in touch with your doctor? Many of my patients are happily surprised at the affordability of their medical bills and have peace of mind knowing they have received quality care by a medical professional with bedside manners, something long lost in the United States healthcare system. My main objective is to assess and protect patients, as a guardian angel would. Patients looking for an option to the high-cost medical treatments in the United States. Patients at risk of falling into the hands of unqualified medical providers. Convinced of this need, I have turned my experience in the medical field to become a primary care doctor, focusing on ensuring that the treatment or intervention the patient will be submitted to is needed, ensuring a full previous evaluation to assess the physical and mental state of my patients, review medical credentials to ensure the medical team is qualified for a certain procedure. Over the last few years, Mexico, and more specifically Tijuana, has made significant contributions to the healthcare industry in quality and cutting-edge technology. Tijuana offers an excellent option for your medical needs, as well as an interesting getaway with a little taste of Mexico. My name is Dr. Maria Batiz. As a rule of thumb, I always treat my patients as family, and I will ensure them the best care available. And when they feel most vulnerable, I will be by their side.